Tell me what you see in me. Gotta be something different. You must be made for me. Patience.
What's up, lovelies? Welcome back to my channel. I am Alexisthenp, and today we are getting into a what's in my work bag. So I will be reviewing all the essentials needed as a healthcare provider, in my instance as a nurse practitioner, in order to have a successful shift. So let's get into it. All right, first things first. So we're gonna get started with some honorable mentions. So I don't carry these things in my bag every day, but sometimes I may need to. Up first is a expandable file folder. So for all my traveling providers out there, y'all already know the deal. We have to keep our resumes in here, all of our licensures, birth certificates, passports, social security, everything. Like, you pretty much have to have all your essentials in here, because let me tell you, you get to these companies sometimes and they don't have your stuff, even though you sent them a million copies via email or fax. And so always bring copies of your stuff. Sometimes they want your originals as well. You do have to have your degrees, like your diplomas, in here too. So this is a very, very essential expandable file folder. For the first week of my contract, I usually carry this around with me, and then afterwards I lock it up, because yes, it does have very important information that is very valuable to me. So it definitely needs to be locked away. So first honorable mention, of course, the girls have to have your Apple Watch when at work. So always just to keep you on your toes, to be able to have great time management. It manages your steps as well. So it's always essential to have the Apple Watch. Typically I will have this on. It won't be carried around in my bag. Always great to have a little notepad in case you want to jot down quick notes, especially within like your first week when you're trying to get acclimated to the new environment and learn a few tricks of the trade, and numbers that you may need to have written down for essential contacts. So always carry around a notepad, and then as you're more adjusted, you can kind of put it to the wayside. And lastly, as an honorable mention, a planner. So definitely great to have a planner. Keeps you organized with important dates and times that may need to be notated. So always have a planner. So now that we got all of the honorable mentions out of the way, let's start on what's inside of the bag. But first, we have the water bottle sitting outside. So it is very, very essential to carry a water bottle with you when you are working. You can imagine working 8 to 5 and talking to patients all day, every day, how dry my mouth can be. And so it's very imperative to stay hydrated and make sure that we're taking care of our own bodies as well. So always carry a water bottle with you, and make sure you're consuming at least 3 to 4 of these per day. All right, so first item out of the bag is the stethoscope, of course. So this is very essential in my practice with listening to heart sounds, lung sounds, as well as bowel sounds, whatever I need it for in regards for my assessment. This is the Littmann 3M Classic. Great stethoscope. I do have a backup. I always carry a backup in case something breaks. I also have another Littmann here with me, but I don't carry that one around. I just keep it here at the apartment in case I need it. So this is the first item out of the bag. Second item, this is a reference guide. So this is the Family Nurse Practitioner Certification Review by Maria Leak. So I use this for my boards to study for the certification exam, excuse me. And so this was very good in providing me fast information. It was quick to the point, and we like that. So if you're ever in a room and something has thrown off, it's something that you haven't studied in a while, you haven't seen, and you need a quick answer, you can always come to a reference guide. I do like to use Hippocrates as well, and I will put the preface of the app on screen just to kind of give you a preview, but that is a great reference guide as well. I do pay the yearly subscription, which I think may be somewhere around $150 to $200 per year, but it's great for healthcare providers. Also provides you with fast facts, and it's simple to carry around. It's less bulkier than a book. So next item, I do have here with me a jacket. So it is always essential to carry a jacket. Y'all know they keep the hospitals ice cold. And so I always carry a jacket around with me. And I always make sure it has my name of some sort on the jacket, okay? I used to work at a hospital when I was a nurse back in Tampa, and we always had these nice fleece jackets. And because everyone had them, people would steal them if they lost theirs. And I don't like that. So in order to prevent that from happening, so I can run up on you and be like, hey, you got my jacket on. A name needs to be there. So whether you write it inside of the jacket or you get it embroidered on the jacket, always carry a jacket with you though. All right, one of the items I like to carry around with me is an umbrella. So you never know the weather where you're going to be. Right now, I'm currently in Arizona. Y'all know that. It is hot as heck out here, but sometimes it rains and it catches you off guard. And now, who wants to be stuck walking in the rain to get back to your car? Not me. So carry your umbrella with you. So lastly, in my first compartment, I do have the immunization schedule for kids. So although I'm a family nurse practitioner, I do not see many children. I'm not a big pediatrics person. I see maybe ages 11 and up, but anything younger, I don't prefer it. Because I don't do it as often, I sometimes forget the immunization schedules because it's a very strict schedule, whether you get your 2-month immunizations, 4 months, 6 months, 8 months, it just depends, your yearly ones, your 2-year-old immunizations. So this is a CDC reference that we have always abided by. And I just pull this out, or let's say a child comes in and they're thrown off, maybe they got their 2-month immunizations, they skipped their 4, how do we proceed? This will let you know how to proceed. So it's a quick reference guide, always carry this around with me as well. All right, moving into my second compartment, y'all know the mask had to be in here. I do carry around my own clinical mask. And these are just like surgical masks in a sense. Even though these are the KN95s from Amazon, I still consider those to be, they're not real N95s. Those are surgical masks in my opinion. So I do carry these around. I put a fresh one on every day just because you don't want to necessarily repeat wear a mask. It causes breakouts to the skin, excuse me. So I prefer to do a clean mask every day. And then I pick up my N95s from the office. And that really just depends on where you're located, especially in a traveling position. It would be essential for me probably to have my own N95s, but because they are providing them to me right now at this current contract, I'm not too concerned. I'll see about future contracts though. Next up, I do have a little scrub cap that I carry with me. So typically I wear headbands with buttons on the side to work, and those are for the mask to attach to. But let's say my hair is getting in the way one day, or you got something really nasty that's coming about into the office, throw on your scrub cap, protect your hair. There are a lot of germs that we work with in the hospital, and so if you need to get your hair out of the way, although mine is usually pulled back, but if I want it out of the way, off my shoulders, off my back, I throw it in a scrub cap. This one does have the buttons on them as well to hook the mask onto, so it's not irritating the ears, and it's a nice representation for my alma mater. Shout out to them Rattlers. So, and I got this one off Etsy if anyone's interested. All right, next up I have my handheld fan. So I am a hot girl, literally, okay? I sweat very easily. I get overheated very easily. So it's imperative for me to carry this around. I pretty much carry this everywhere. If y'all know me for real, y'all know. Y'all never see me without the fan. So I love this because if I'm in phone clinic or if I'm charting at the desk, I can prop it up, sit it here, and it cools me down. Nice and easy, and it can be broken down so that way it won't take up too much space. So I love this. Got this off Amazon as well. So next up are some essentials as well. Pens. I have numerous pens in my bag. I just pick up pens from Dollar Store, Walmart, wherever I can get them. I always got a new pack on deck as well, because you always need pens. This is from basic nursing, okay? As a provider, you're always gonna need a pen. There's always something that needs to be filled out and signed. Carry your pens, okay? Next up, hand sanitizers. I have a lot of these in the bag as well. I just like to carry around the minis versus big bottles because I can throw these in my pockets. Working in the hospital is very easy anyway because they already have the dispensers every corner you turn. But if you just kind of want some to keep in your pocket, you can, and that's what I choose to do. And these are just like the little mini ones. I also have a lock in here. So let's say that they provide you with a room where you can lock your items up at. Put your bag away because, hello, the bag is big, okay? Who feels like lugging that around all day, every day? If they have somewhere to lock your items up, lock them up. You have your own lock. You know, you're the only one who knows your code. Everything will be good. So lock your stuff up. The next little thing that I have is a little reference card. So this is specific to this facility, and it's just all of their security alerts or specific codes that you may need if you are in any type of danger. So I just keep a little reference on me just in case. I could attach this to the badge reel, but I'm not carrying all that extra stuff around. As long as I just have it easily accessible in the bag, I can carry that. Next up, of course, a wallet. So I do carry around my wallet. I have all my money, cards, keys. Sometimes I'll keep in here. So make sure you have some cash flow on you. You never know if Apple Pay is taking, cards are taken wherever you are. So have some cash as well as your cards. I also have like a little necessity pouch, and this is like for feminine products. So I have feminine products in here. I have my little headphones. Please do not go on a shift without your Apple AirPods. It will be horrible. I'm telling you. It will be absolutely horrible. It's always great to have some background noise of your preference. Carry your AirPods. I always carry me some gum. I like to usually chew a little bit of gum and then spit it out because you can't talk to patients with it in your mouth. It's kind of difficult. But chew some gum after I eat my lunch, freshen up my breath, especially putting on those N95s. Girl, it's like you're just breathing in your own breath, and if it's a little foul, so carry some gum or some mint, something like that. Next in the pouch, I have my Aquaphor. So Aquaphor is what I choose to use to moisturize my lips. I have been using this for years, probably like since middle school, because it was dermatologist recommended for me to use because I can have breakouts around the mouth, and so this was moisturizing, but it wasn't enough to clog the pores and cause any blackheads or whiteheads to form. So I really enjoy this. Everyone knows I carry around my Aquaphor with me as chapstick, and it is an essential need with wearing masks 24/7. So make sure you have something to moisturize your lips. Next up, I have some antibacterial wipes. So antibacterial wipes are pretty essential if you want to wipe down your areas because, you know, me as a traveler, you're going into these different environments. You don't really know their cleaning policies, but you know you have to exist in that area. So you clean to your likelihood, you know? And so I always carry like just a little mini pack around, and then you can wipe down your phone with these because of course, we're gonna be on our phones sometimes during a shift, or even if you have to be on your phone during lunch, but your hands have been dirty, and yes, you've been using hand sanitizer, yes, you wash your hands so many times, but you have not had a chance to desanitize the phones. So make sure you just carry something small, antibacterial wipes, or a little small can, travel size of Lysol, whatever your preference is, have something. Next up in my little toiletry bag, I guess you can call it, I do have some hand cream. So our hands naturally dry out because we're washing them excessively or sanitizing them, and so it is good to kind of have some hand cream, but you want something that's not heavy in scent as well as not super greasy, and it doesn't leave any type of residue, and it absorbs quickly. So this is a great hand cream. I picked this up at their little local grocery store here. It does promote 24-hour wear, and it definitely does not leave my hands greasy, because that is a bad thing to have greasy hands working in healthcare. You do want something that's moisturizing, but you do not want anything where it changes your grass, and then also greasier things stick to bacteria, so you don't want that. And then lastly, I have some medications in here, some prescribed headache medications. I get really bad migraines, and so when I'm at work, you can't leave work because you got a headache, okay? You can't leave because you're sick. So period cramps, headaches, if I'm short of breath, because I do have asthma. I haven't had to use the inhaler in a while, y'all, but that's in here too. So any of my prescribed meds that I really need on the go and need to have easy access to, I keep those in here as well. Lastly, I do carry like a little snack with me. So working numerous hours, you never know your patient load. So let's say you have, you know, a heavy load, a heavy morning, and you don't really have as long as a lunch as you would like because you are busy charting. Always carry like a little snack with you. I always keep like maybe like a protein bar, either a snack bar in my bag, maybe some chips as well. Just something to munch on to carry me over until I can really get a real meal, because sometimes that's very limited. Our schedules are very jam-packed, and it's a bit difficult sometimes to get a meal in. Yes, we do have to still eat, but if you aren't able to have a longer lunch, that may limit of what you can consume, and so it's always best to have something, some sort of fuel for your system to proceed throughout the rest of your shift. So always carry a small little snack. All right, y'all, so that is it. The bag is empty. Okay, so that is my essentials to what keeps me successful on a day-to-day basis here in the workplace. So if you liked this video, make sure to give it a thumbs up. Drop down in the comments some other suggestions of what you would like to see from me. And as always, stay tuned. Thank you all so much. Please remember to like, comment, and subscribe. And I will catch you all in the next video. Bye.
Gotta be something different. You must be made for